Hello everyone, welcome to the frequently asked question series in relation to Ozempic and any of the other injectable diabetes and obesity medications. One of my patients is going to be starting this drug this week, and she is also turning 30. She is also traveling, so understandably there was a lot of anxiety in relation to a new medication being started at such a critical stage of her life, and hence she sent me a variety of questions, and I thought they were very intelligent questions which a variety of other patients are asking as well. Therefore, I wanted to make it special specifically for her and other patients who may be feeling a bit anxious in terms of starting these new medications. So I'm going to read up some of her questions, which are very common, and I'm glad that she asked them. I'll try to answer them as accurate as possible. So first question is, hi doctor, I'm planning on doing my first Ozempic injection today. Just wondering if there is a preferred area in the body to inject and time of the day. Also, do I take any anti-sickness tablets at the same time? If so, how many? And do I continue to take them if nausea comes up? Thank you. Thank you for asking this question. So first of all, the preferred sites. So I normally prefer on the sides of your abdomen because there is more area. There's more kind of area for fat. So at least one hand width from your belly button, you can go on the side. Either side is okay. And try to rotate the side. So if you are injecting on the right side, as the first injection, to the left side on the next one. You can also use the area under the arm where there may be a little bit of hanging fat, but this is my less preferred side because sometimes you can hit the muscle, which can cause a little bit of pain, and the sides of the thighs as well, which are sometimes used by certain patients. It is advisable to rotate the side. So starting from the abdomen for the first month or first 3 months, you can rotate to the thighs, and you can also rotate to your arm side. Now coming to the second question, which was in relation to nausea pill. Now nausea pills, you can actually take them from the start of your first injection because the response can be quite unpredictable. I normally prescribe ondansetron 4 to 8 milligrams, and the advice would be that with the first injection, I would suggest that you take it before each meal for the first 3 days to make sure that you are not having extreme degree of nausea, which can sometimes be quite troublesome, specifically if you're traveling. So if you are injecting today, so today, tomorrow, and day after, before breakfast, before lunch, before dinner, take the medication to make sure that you are comfortable. The other advice is actually to have smaller portions of your food and eat slowly because it's the fast eating habit. Bigger food portions, more starchy, carb-rich foods, which can actually give you more nausea. Make sure you are hydrating yourself. Make sure you're not getting too constipated. So fluid and fibers are extremely important when you're starting that. Nausea, if nausea continues, most people who start appropriately on the low dose, they are fine. So the first injection might give you a bit of nausea, maybe the second one, the third and fourth are usually okay, and hence you don't need any nausea medications to be continued, provided you are feeling okay. And provided there is any nausea ongoing, you can always make sure you follow some lifestyle interventions like smaller food portions, making sure you're eating slowly, making sure you're having plenty of fluid, and that helps. You're traveling to Scotland for 2 weeks in July, and is it bad to miss a week? Now, normally consistency is the key in terms of these medications. I know travel can be a bit of challenge, specifically the cold chain has to be maintained. The injection has to be in your hand luggage. It has to be with a cold box. So depends on the duration of travel. If you're traveling for 3 weeks, I always advise you should be carrying the stock with you. 2 weeks you can get away because the injection can be taken at least 3 days before and 3 days later on. Let's take a scenario for travel. In case you are taking your injection every Tuesday and you are planning to travel on Sunday and your next injection would be on Tuesday, you can actually take the injection earlier on Sunday, and then avoid carrying the injection with you if it is only a week's travel or 10 days travel, and come back and take your next injection. I will try to share a video in the explanation which I have specifically made for travel purposes, so have a look at that, and that might explain how you should plan your travel. If you're traveling for more than 3 weeks, then of course I would suggest that you carry on with your medications as usual and try to carry it in a way which does not disrupt the cold chain. The last question, actually it's my 30th birthday next week. What are the implications for a few drinks? Sorry about asking so many questions. Please don't apologize. I'm more than happy to answer your questions. First of all, happy birthday in advance. I hope it's an enjoyable event for you and your family. I don't want it to be disrupted. The most important thing for all these medications is that you should not feel anxious about them. Do not be scared that it is going to be really disrupting your routine. If you are feeling that anxious, then perhaps you can avoid starting it until you have gone through your special day. And I know if it's your special birthday, there might be food, there might be some drink, there might be some eating habits which can interfere with the ability of the drug to do its effects. And the side effects can also be more prominent if you are eating fast, if you're having bigger food portions, starchy, fatty meals. So if your birthday is planned next week and you're a new starter, my advice would be that you skip this week and start it only after you have celebrated your birthday, to make sure there is no side effect interfering with your special day. We don't want that at all. If your birthday is next month, then of course you will be well established on the medication in 4 weeks. Usually first 2 weeks are a bit difficult, but after that you get quite used to the drugs. Everyone is very unpredictable. We cannot say that person A tolerated it and person B did not, so this would be generalized. No, it's an individualized approach. We have to make sure that we are looking after you as a person and not anyone else. So depending on how you respond, how you feel, let me know, and I would guide you through that. So my best wishes to you. I hope I've answered your question. Take care.